Hey everyone, I'm blocking sweet Amanda's face. Okay, we are here at
Children.
Thank you.
Riverton.
In Riverton, the audiology department here, and this is Dr. Ranae Layton and Dr. Amanda Pay, and they have some really amazing audiology myth tips and maybe some misconceptions or misunderstandings about hearing that we might hear. So they're just going to clear those up for us. So take it away. Thanks, guys.
Go ahead. So what we're going to talk about today are like we just mentioned, a couple little myths and tips that can be some misconceptions about audiology, or in particular maybe children here that we're working with. So we'll just jump right into it. One of the first myths that we get a lot is that you cannot test a baby's hearing. A lot of people are like, how do you test a baby's hearing? They can't really respond. There are multiple methods that we can do. They vary from very simple to a little more complex. Some of the simple things is simple behavioral responses we can watch as we play sounds for them, also to our voice at different levels. Going to a little more complex where we can measure their auditory response from their auditory nerve from sound stimuli. And we can even do that while they're sleeping and they don't have to respond at all. So there's multiple ways that we can check and test for a baby's hearing. So that's one of the myths that we get a few times. Another myth that we have is that a child cannot, or that a child can grow out of a hearing loss. Some parents are like, well, this is something that maybe they'll grow out of. That depends on the type of hearing loss. There are a couple different types of hearing loss. There's one that is called sensory neural, and that is where the nerve within your ear is affected. That would be a false statement. You cannot outgrow that. That is something that's going to be there and needs some treatment. There is another different type of hearing loss. It's called a conductive hearing loss. That is where a hearing loss may be caused by something that's not so permanent. It could be middle ear fluid or other areas affecting maybe the eardrum or things that can potentially be managed. So in that case, there is treatment for either one. We can treat a hearing loss that is going to be a more permanent nature, and then there's also treatments for a conductive loss where it may be able to be treated and get better over time. So, and if anybody out there has any questions about any of this, just pop them up and we'll be happy to answer, but we'll just kind of keep going along until we get some. The other myth we get is ear tubes. I know a lot of parents have probably heard about ear tubes for their children, that ear tubes can fix all types of hearing losses. And that is going to be false for sure. Like we mentioned just previously, ear tubes can help to clear out middle ear fluid. Sometimes if a child just has issues with pressure equalization in their middle ear area, that is something that tubes can help and potentially help their hearing get a little bit better. But again, if they have the type of hearing loss that is affecting the nerve, then ear tubes are not going to be the answer for that. Another myth we've had is that my child can't have hearing loss because he or she responds to sounds. So some parents will say, well, they're responding at that. We notice they respond to sounds. They look over at sounds when it happens. How can they even have a hearing loss? Well, hearing in general is a very dynamic thing. So you can have hearing loss that's very mild, where the child cannot hear very soft sounds, or in different pitches, such as like high-pitched sounds or low-pitched sounds. And so maybe if something is very loud, they can hear it if it's loud enough for them to hear. But say something happens at a soft level where they do have hearing loss, or in an area they have hearing loss, they're going to miss that. And oftentimes children will hear a lot of the loud things, and that can kind of sweep over, or we call it kind of mask over, important information such as speech information that's a little quieter. So hopefully that makes sense. And Ranae, add anything if you want to.
It's just making me think sometimes parents understand that and they come to the realization because they're the ones coming to the appointments. But then you take the child to grandma's house and she's like, does he really need these hearing aids? Because it looks like he's hearing and does just fine without them. So we're always happy to have extended family come to appointments or have them email us or call us so that we can go over this too and explain why they may be responding even though they have hearing loss.
Yes, very good point. Thank you, Ranae. Now, and that leads us a little bit into, okay, so if we do identify there's some hearing loss, when is it too soon? Some people have been told or under the assumption that infants are too young to be fit with hearing aids. Or sometimes they're told a certain age, this is when they should be fit. That is absolutely a myth. What we really want is we want the moment, even a teeny little infant, the moment we know that there's some hearing loss and at what level, we want them to be getting treated with hearing aids. Simply because we want them to have access to all of the speech information they can and put them on the road to success. And the sooner and the younger we can do that, the better for their little brains to start getting all of that information in. So any age, hearing aids are appropriate for any age, and and I'm sure our opinion, the sooner the better. Good. This also kind of leads into what we just answered. Some people have told us that it's okay to wait to fit hearing aids until the child is a little bit older so that they can pick out what they want. And that is something that I would definitely not recommend doing. Make sure to get that treatment on them as soon as possible, and then as they get older and once they get more opinions, then we can kind of discuss how to change it up as they want to. But I feel it's a disservice not to get that child the resources they need and treat them as soon as possible. So parents, make that initial decision and then move on to once the child gets older. Okay. Now, another thing is parents sometimes maybe get a little bit worried that their child is not going to keep the hearing aids on. It's very daunting for a parent to say, oh my word, they don't like wearing anything on their heads. They're going to grab on them, never keep them on. That is true that children will be interested in them. They're going to, want to be curious, and that's how a child acts. But in no way do children not want them on. All children. I have a lot of patients that I've seen, and I don't know if Ranae has seen this too, where the child, even at 2, will start to ask for them because they have started to realize that these help so much, so they start liking them a lot. And I even have a couple patients that have named their hearing aids, and they're so cute. They love them.
Superman ears.
Yes, Superman ears, or actual names. And so it is challenging as a parent if the child is very young and wanting to try to be curious with them, but you just keep putting them on them, and then after a while, a lot of times they just get used to them and it's a part of their routine. Just like as brushing teeth, kids don't love that initially, but once they learn this is my routine, they grow up, that's just their routine, and that's how they live and how they go.
And in that stage where they're exploring and always taking them off, and maybe it seems impossible to keep them on, we say to start kind of small, and maybe our goal is to have full wear time, but for now we just pair it with, okay, they love eating this. So whenever you're feeding them that, you put the hearing aids on and you talk to them and try to tie it with things that they love or watching their favorite show, things like that, so that they start to see it's a positive thing.
Yes, very good point. Very good point. Thank you, Ranae. One other myth that we have is if I pick the wrong hearing aids, we are going to be stuck with them. Any audiology clinic that you choose to get your hearing aids should offer a trial period. So here at Primary Children's, we offer a 60-day trial period. And this is critical because we want to make sure that before you feel like you're stuck with them, or before we make a full-on decision, that they're going to be appropriate and work for you and your child. And so make sure that you get your trial period, and in that area we make adjustments, we make sure everything is correct to go forward and keep the hearing aids. So yeah. So if anyone has any questions, feel free. We'll answer them. I'll turn the time over to Ranae for some other myths.
Yeah. So another one we hear are hearing aids are only needed when a child starts school or only need to be worn during school hours. And we know that the success for developing speech and language needs to start early when they're getting auditory input that's consistent. And hearing loss really is an access issue. So it doesn't just affect listening, it can affect learning and also social interactions. And so we want to make sure that at home too, children are getting that consistent input. Also, it helps them attach meaning to sounds, and that's really important to start early. And I kind of like that saying, if eyes are open, ears need to be on. So just make sure if they're awake that they have their hearing aids on and working properly. We often talk about listening as everyone has a listening bubble. And it's the softest sounds we can hear and at what distances we can hear. And a child with hearing loss starts with a small listening bubble. So they need to make sure they have their hearing aids on in order to maximize that and to have what we call incidental learning or overhearing. They say 80% of vocabulary is learned through that overhearing or that incidental learning. There's some other great numbers here that children should be exposed to about 46 million words by the time they're 4 years old. So how critical that window of language learning is. And then this one too is great. A child should have 20,000 hours of listening before their brain is ready to start learning reading. So all of those other things are interconnected with listening. We want to make sure that hearing is going on at home, with friends, as well as at school. It also impacts the way that they have their self-concept or the way the child sees themselves. And they're at risk for that when they have hearing loss because they might be missing some of those things that are happening outside of their listening bubble, missing certain, they might be hearing the general message, but maybe missing certain cues in the conversation or certain sounds. And we want to make sure with hearing aids that they are expanding that listening bubble to have access to everything they need socially. We talk a lot about how attitude is caught, not taught. And so it's important not to just say to your child, you need to wear these hearing aids, they're really important, and then every time you leave out of the house, you take them off. That might make them feel that their hearing loss or their hearing aids are something they need to be ashamed about or have to hide. And so as long as you're positive about it, and this is just something that helps you hear, just like some people wear glasses to help them see, that's the attitude that they'll adopt and be able to feel confident about their hearing as well. And just talking about school makes me think about really having a team approach and involving people that care about your child or are with them from day to day. So having their teacher know about the hearing loss or teacher aides, even playground staff or the school nurse. And then educating them on some simple troubleshooting tips so that if your child's battery needs to be changed and they need some help, they have multiple people that they can go to that care about them and are there to support them. Another great thing is to let gym teachers know or coaches know that your child may be doing great with hearing aids, but in tricky listening situations like outdoor areas or noisy gyms, they may struggle, and coming up with some accommodations to help with that. Okay, another good myth, or I guess I should say another bad myth, is a child doesn't need a hearing aid if they just have a mild hearing loss or they just have hearing loss in one ear. I'd like to just throw that just word out because there's no such thing as just a mild loss or just anything with hearing. Even a mild loss can really impact that child in their life. And so let's just throw that word out and realize that they may be, we really hear with our brains, the ears and the hearing aids get the sound there. We try to emphasize that a lot with families, and that even though they may seem to be doing okay or just getting by, their brain actually is having to work overtime behind the scenes, filling in things. And how hard that is, especially with learning or in social situations where you're trying to focus on things, if your brain is having to work overtime listening. We call it listening effort. And the purpose of the hearing aids is to help reduce that mental load. So, you know, life is just hard enough as it is. So if you can lessen that listening effort and just focus on life and learning, then that makes things a lot easier for children. They're doing a lot of research currently right now with children's cortisol levels and their stress levels, and how children with hearing loss, if they're not using amplification, really are spending all that extra effort trying to listen when it really isn't necessary. We can relieve a lot of that with appropriately fit hearing aids.
Yeah.
Let me think another one of these. Also, it's important to fit them early, even if it is mild or on one side, because the brain will reorganize. If we're having something going on with one of our senses, whether it be touch or smelling or hearing, the brain will take that information and reorganize and reprioritize things. And we want to make sure with hearing that we're getting consistent access to sound so that those brain pathways form and are strong and maximize their listening potential.
Let me add one thing, Ranae, with that. With a single-sided, if you've got hearing loss on one side, I kind of like to look at it as with eyes. We have two eyes for perception. With ears, it's the same thing. You do really need to have both of your ears for a good point of reference. Without both ears, you lose a lot of ability to localize where sounds come from. So we look at, that can be a safety issue for young kids. And then also, when you're in background noise, it's extremely difficult for your brain to focus on trying to hear what it wants to attend to when you've got all of this other stuff going on. So to have both ears actively working at the same levels really helps. It enables the brain to be able to focus on what they want to hear and tune out what is not important information for them at that time.
That's great. Yes. Thanks, Amanda. Another one we get is that hearing aids are not cool. Hearing aids are super cool.
The coolest. Can we just say Bluetooth?
And have gotten a lot more cool as the years have gone on. Having said that, though, it's easy for me as the audiologist to say, oh, they're cool. I'm not a 14-year-old having to wear them every day. I'm in middle school. I was meeting with a great kid last week, and he's a preteen, and he hasn't been wearing his hearing aids lately, so we were trying to ask why. And at first he was saying, oh, the ear mold just doesn't seem to be fitting right, and then he got really brave and shared the true reason, and it was because people are pointing out his hearing aids. And I thought he phrased this so well, because we were asking more and more questions, are you being teased, are you being bullied? And he said, no, people just point them out. He said, one time I did get teased, and it wasn't fun, but I got through that, but I just don't like people noticing them. And the way he phrased it, I thought was so great. He said, I don't like the hearing aids being pointed out for positive or negative. And we thank him for sharing that. That can be so hard to talk about. And although I don't fully understand exactly what he's going through, because I don't need to wear hearing aids, I do have times where I've wanted to fit in so bad, and someone's pointed out something that's different about me. And it's normal to want to be normal, right? And one of the easiest ways to work through that, or best ways to work through that, is to talk about it and to share those feelings with other people that care about you and can help you through that. So I encouraged him to talk about that more with us and with his family, extended family, friends. We have a great resource at Primary Children's with wonderful social workers that families can meet with their child and come up with some really good coping strategies and validate those feelings. Also, school counselors would be a great resource. And then another thing is to come up with maybe some preparation phrases you can say. So maybe it's one word, maybe it's a couple sentences. Okay, you're starting second grade. What if you have someone new in your class that hasn't seen your hearing aids before, and they say, what's that in your ears? What are some things you could say? Or you're at the store and someone asks you about your hearing aids. What are some things that you could say? And just really helps empower them. And then also just letting them have some ownership of the hearing aids so that it's a part of them. So picking out colors, picking out some of the features. If it's a color that maybe they loved in 5th grade, but now 7th grade has rolled around and they're not liking it, hearing aid colors can be recased to a different color. There are skins that you can put on them with different prints or even pictures of your favorite sports team. All kinds of things to help them feel that they have some ownership and control over their hearing aids. So some of the reasons that they're more cool now, you mentioned Bluetooth. Most of the hearing aids now can directly pair to iPads, iPods, so that they can directly stream phone calls through their hearing aids. Music, videos, we always say not during math class, not during school. We make them promise. It's so great to want to stream all the time. But that's been just a game changer for kids to be able to have access to all of those things through their hearing aids.
And hearing aids become their earbuds. And a lot of my patients have said, like, my friends think these are so cool.
Yeah.
So, yes.
It's been wonderful. And so that's made them cool. All the different color options that are available now. Accessories. So a lot of our hearing aids now come with something at no additional cost called a Connect Clip or a remote mic, where a parent can wear a microphone, let's say, for instance, in a car, and the child in the back that's not able to get visual cues can have their mom's or dad's voice streamed right through their hearing aids in the back so that their voice is louder than all the other background noise. They can use it at church, at a podium, or a conference. Restaurants are great where there's a lot of background noise, and the person across from them can wear that microphone, and then their voice is just streaming right through their hearing aids. So they are cool.
They're amazing, yeah.
A lot cooler than they used to be. Yeah. How about this one? Follow-ups after the hearing aid fitting are just a way for audiologists to charge me more money. Healthcare is expensive, and we understand that, and we want to explain how important it is to do those follow-ups for two reasons. One is to make sure that the child's hearing isn't changing, so we monitor their hearing thresholds. And then another is to ensure that the hearing aid is programmed and fine-tuned just for the child and giving them appropriate amplification. And kind of the timeline that we do at Primary Children's is we do the initial fitting, and then we see families 1 to 2 weeks later, talk about how things are going, do some testing. If things are going well, then usually a month later, and then every 3 months, depending on the child's age. And then we get to a point where we see them at least every year, sooner if there are any concerns or problems. And here at Primary Children's, we include that first year from the fit date in the cost of the hearing aid. So we're not charging anything extra for testing a year from that fit date, just to make sure everything is going well. And then it's important to follow up in those yearly follow-ups, even if things are going well, again, to make sure hearing isn't changing and that the hearing aids are programmed appropriately. As children grow, their ear canal size changes, which can affect the acoustics of the hearing aid. So we make adjustments in the programming for that. Also, we might want to start enabling some certain features later on down the road that they weren't ready for previously, like directional microphones or having multiple programs to try in different situations, or the volume control. So make sure that you're always coming to those follow-ups. And if finances are an issue, please bring that up with us. There's self-pay discounts and payment plans and financial aid available. So always bring that up with us. We don't ever want someone putting off follow-up appointments because of finances. How about this one? My child really doesn't need speech therapy. That can happen, and already you're having so many appointments, and then to add on more can be frustrating. But just as a pediatrician sees infants regularly to measure their height and weight to ensure they're growing as they should, we want to do the same with speech and language, because unless someone's tracking that, we won't know how fast they're developing or at what level they're at until it's too late and they have a delay, and then we're trying to play catch up. So it's really important to involve a speech therapist if your goal is oral communication early on, so that we have someone, a professional, that's checking on that and monitoring it and can get the child help as needed. They're also great to involve speech language pathologists for advocacy, and they can teach children advocacy, not just listening, but reading and spelling and all of those things that we talked about earlier are intertwined. They can meet with the child's teacher and set up classroom accommodations and things like that, along with the school district audiologist. So it always helps to have a team approach and to be using all the resources that you can, so that you're not doing it on your own and your child isn't doing it on their own, but we're all working together.
Yes, yeah, and to add to that really fast, I have many patients that will come in and the parents have said, okay, the speech therapist has noticed that maybe my child's not hearing or saying the S's or a certain area, and something that, maybe at home, just in the daily lives of parents just hadn't quite caught on to, and that speech therapist has, and tune the parents into this, that, hey, maybe visit the audiologist. We will go forward and do some testing and make sure and just see, and a lot of times we'll find, okay, maybe we need to tweak that area and make sure that the child is able to hear that. And so it's really valuable to, like Ranae had said, have a big team approach, and all of us just have the child's best interest at heart, and that way, like Ranae said as well, we're not trying to play catch up. We can reduce the issue of delay even happening, from an auditory standpoint. Yeah.
How are we doing on time?
We're doing good. I think we're still about 5 minutes.
Okay, we have a couple more. So how about this one? The smallest hearing aids are the best hearing aids. True or false?
I would say false. Not in every situation. They could be for some situations and some not. It all depends on the hearing loss of the child and the specific needs. So that's where, if parents even have questions and they're like, I'm just not sure, come into us or go into your audiologist and just have an evaluation. Just get yourself informed on what would be the most appropriate, because each hearing loss is very different, obviously, and there's multiple different types of hearing aids that can target what we need to do. So we'll go over options and things like that.
Yeah, what they're a good candidate for, and we can even email links to the manufacturer's website so you can see the features. And it's not something that we ever want someone to feel forced into purchasing. So if you need more time to decide or you have more questions, we can do multiple appointments or things like that.
Yeah, and we do that often. We have people come in just for an informational, just gather some information, say, okay, we're going to go and, wrap our brains around all of this and come back and make decisions. Sometimes they've come back a couple times for a couple different evaluations with more questions. And we're always happy to do that. I think education is the biggest key to your child's success.
And that trial period is so helpful too, because if you or we feel like the hearing aid that we fit isn't working best for your child, we can change within that 60-day trial period and try a different model or move to different things. Here's another one. Hearing aids cause hearing loss, further hearing loss. And that definitely is false. It is possible to over-amplify with hearing aids as well as under-amplify. And so it's very important to come in for those follow-up appointments. If it's fit appropriately, there shouldn't be any risk of further hearing damage. We use verification really carefully with our fittings, and we have equipment where we can test to make sure soft sounds still sound soft for the child, and we want loud sounds to sound loud for them, but not too loud, so we can set almost like a ceiling or a roof that loud sounds can't go above. So that's really important to make sure we're doing with follow-ups.
Yeah, absolutely. One more myth that I was thinking about is hearing aids can cure a hearing loss, and that is false. Hearing aids can treat a hearing loss. It cannot cure a hearing loss. So, treatment is key for the success of the child.
Yeah, and expectations. So explaining to the teacher that although Jim might be doing great with these hearing aids, he still may struggle in certain situations. It doesn't cure the hearing loss. It doesn't restore hearing. So just to make sure that they're having open communication with you, that if it feels like he isn't paying attention or he seems to be zoning out a lot, to let the parent know, and then they can let us know so we can work on programming that and making sure he's getting everything he needs.
Good.
Yes.
Yes. All right. Yeah.
Do you guys have any questions? Does anyone have some questions that they kind of struck a chord with them? Maybe if they heard something that. Anything, if you have something, feel free to submit it. If for some reason you don't think of something right away, we can always email.
For sure. Yeah, reach out and contact us.
Yeah.
They have been super willing to share. And we, I will later come back and put some resources on there for financial information, little kid hats or things to help keep baby hearing aids on.
Yeah.
Some other resources like that. If there's something else, please feel free to say, can you share some information about this? And we will have some information back for you about that. So,
Yeah.
thank you so much, guys.
Thank you, guys.
Have a great time, and we will see you next month. Bye.